Very good afternoon, and it's nice to see at least some people are still here and seeing the IT-enabled practice management. Before starting my talk, I want to really acknowledge two important people. One is the previous presenter, Dr. Rajeshwari, and her husband, Mr. Satish. So I've used a few of his slides. Of course, there may be some amount of overlap. And Dr. Rajeshwari was behind the scene for developing the EMR. She really pushed her husband to develop the EMR. He is a... So in fact, if you're looking at the healthcare and IT, there is no way out for us other than trying to adopt some amount of IP, if not IT, if not everything of the IT sector. As a doctor, we have some amount of limitations in the sense we don't want to learn too much into the IT. We are all used to certain kind of practice. Looking at the current state, definitely the hospitals have adopted the IT to a reasonable amount of extent, but not the private hospitals or the small private players. But I won't say that everybody, but majority are slowly picking up to adopt to the IT. Sometimes even better than the hospitals, the private clinics have adopted to the IT. Most of us do use it probably for the patient search. When the patient don't bring their ID card, we try to say that, okay, give your number or phone number, whatever, to search the patient details. Generating the bill, probably to manage our areas of interest, pharmacy, opticals, something like that. And of course, the investment in IT is still considered as not very essential. That is the problem with us. Just giving a small scenario, one of my well-wishers called me up and then said, I am getting more of astigmatism in my patients recently. So of course, there is a lot of things running in our mind. These are the questions that I had asked him. At least 15, 20 questions I have just put it across. Then finally he said majority of the questions he couldn't answer because he didn't have any data. So many times it is our feeling that we are getting more problems. We don't know what was there earlier and we are just facing it now. So I told him probably you were inducing more astigmatism, so it was getting nullified. Now you are getting proper surgery, you are doing proper surgery, so you are not probably getting the astigmatism. So he was really kind of taken aback and saying that, okay, now we need the data. Without any data, there is no point. So IT in healthcare, of course, we get a lot of information on, for example, emergency department, though we don't have much of an emergency, but still. So there are a lot of areas, bed management, hospital supplies, opticals, medicals, medical records. Our core area of interest is the medical records. And all these areas are there. So definitely the effective implementation of the information technology in our practice definitely gives back some amount of return of investment. Managing growth also goes in a different way. But we have to be compliant with the statutory boards like NABH and ISO, etc. But ISO, I don't know about in Delhi and other places, but it's not that difficult for us to get an ISO. But definitely there is a satisfaction from the patient perspective. So there are a lot of leveraging in the IT. Do we really want to use IT, or when can we use the information technology benefits, and are we ready really to use the IT? So looking at the patient management perspective, there is a storage, retrieval, tracking the patients, easy payments and refunds. So I was in Singapore 3 weeks ago. The whole thing was completely managed by the IT people than the doctors, except giving the prescription. Otherwise, everything is SNEC or our other hospitals. The IT has been, so much has been used there. So this is the patient information. You have everything in that, starting from where they were born or whatever, all the details, economical status, everything you have. So for the patient perspective, if you see what patient wants. They want to register online, they don't want to come and register here because there's a time taken, so they want to go to the website and just register. Clinical examination data, today if you say that I'm going to keep all the records, they are not too happy about it. They want their records to be there with them. So they can access online, investigation reports, what are the medications. We know that the doctor's handwriting is the best handwriting in the world. Nobody can understand. So they want their prescriptions to be clear. Opticals, they want to go online and see what is available. medical reports, and people do ask for other certificates like fitness certificate, disability or emergency certificate, whatever. Disease information they want to learn, and availability of the health personnel. You can't just say I'm going to conference to Delhi. You have to be putting up in the net so that they can see when you are available or not. All these things are from the patient perspective one has to understand. When you're looking at the doctors, for me the most important area is the medical audit. Though I have mentioned all the details, we are interested in almost all the parts. But the medical audit is one area which I am really keen to look at when you have the data. This is one of the statistics which I'm just sharing it with you. So you have 2013 and 2014 data, and you are trying to understand how many new patients had come to your clinic and old patients. So I was just discussing with my own colleagues. They said, I'm seeing 100 OP. So 100 OP means what is that? Is it a new patients you are seeing, or is it a review patients you are seeing? What is the effectiveness in your hospital? If you keep on seeing the review numbers more and more, you are not going to generate any income for your hospital. Probably yes, to an extent, but the people are not accepting you or whatever, the other reasons. There are so many reasons. So this is the patient flow. Red ones are, there is a waiting. I think all of you must have seen the EMRs. Different EMRs give you different kind of things, how you can go about. So most of the labs nowadays, they use the photographs, which is again important because sometimes the names are so common, when you just click, the names will be coming. So it's better to have the photographs so that there is no mix-up of things, especially when you're doing the visual fields or some investigations, there is no mixing up. So EMR definitely is a requirement, but going with the EMR is a bit of a lazy job for the doctors. Many times what we had problem is, many times we are facing, the back is facing the patient, or we are not concentrating on the patient. We are just turning towards the computer and we start typing. So the patients feel that they are not being seen well. But nowadays you have the option of using it in the tablets. You just keep it on the table, in your slit lamp table, and then just type it. It is so user friendly that you can just adapt to different kind of EMR systems. Or you can use, all our staffs can be given at tablets or even mobile phones to enter the data. This particular EMR is enabled with your Windows-based or Android-based things you can utilize. So just looking at the investigation, again, it is something similar to the medical audit. What is that you have done last year and what is that you have done this year? Is there any difference? Is there a minus values for you to be concentrating on that sector, or plus value? If it is plus, too high a plus, there is something wrong. Too high a minus, again, there is something wrong. For counseling, again, you have to use the counseling materials in the EMR, not in the EMR exactly, in the IT sector. Nowadays, the patient wants to see what you are going to do. You can't just say, or many of them will be just doing their homework at home and then just say, come and tell you, you put me this ICL with this diopter, this. So the patients are quite aware. So you have to be very clear in what you are going to do. So the counseling is another area. Insurance, now majority of the patients, my practice, I started with 5% of insurance. Now 55% of my practice is insurance. So I have to understand when you are going to submit your, even the tax, if your 55% is your insurance-based patients, whatever manipulation you want to do is remaining 45%. So you have to understand that it is not only the teaching for patients and things, medical auditing, there are so many other things. So OT management, again, you have the case sheet, enter all the data, then again you get the report, 14, 13, what is that you have done more, what is that you have done less, and regarding your other lenses, how many lenses you have used. And this is the post-op that you have to enter so that you can understand how much is your induced astigmatism overall. And inventory management, you have the billings and receivable managements, you have the vendor payments, you have the purchase payments, cash management. So everything is in a pack for your in EMR or whatever you call it as. As far as pharmacy is concerned, again, you want to understand how your prescription pattern is and how you are paying your vendors, how you are purchasing, how is your PO. Everything is in detail. So looking at the anti-glaucoma medications, I was thinking I was giving more of prostaglandins than timolol. But then you can see that everything is equally distributed. So all the other medications, here the sales, the number of vials each, and what is the percentage. Optical shop, again you go with the barcoded things so that there was There are no people to take away your frames or lenses, so the stealing will be less in your optical shop, because that is one area it is difficult for us to control, the frames and the lenses. Many people usually take it and they have understanding between the vendors. So activity tracking, again, there are a lot of activities you can track, including the securities. So you have the security cameras everywhere. The same security camera with your recorder, you can utilize that for your theater also. The same Godrej, whatever you have, 2 GB or whatever, 1 TB, 2 TBs, all are available. The storage device, you can use it for your recording purpose also in the theater. So it was new information for me also when I started recording. You don't have to really buy the Sony for 3.5 lakhs, 4 lakhs. This is about 15,000 rupees, 20,000 rupees. You can have the storage device. You have to use it for HR, integration, medical information systems, medical legal marketing, and of course for the telemedicine. I have the practice of doing every week we have a class between 9 to 10. We use the telemedicine across India and outside India also. We use the academic forum. So this is all we can use, but it is limitless. There is no limits. Everybody has their own requirements and needs. Only thing is you have to understand what kind of an EMR you want to buy and what is that you are looking for in the EMR. But you have to understand that incomplete. If you don't understand what you are going to buy and use it, you will never use it. So please understand what you want. You tell the company people what is that you wanted. You modify it for yourself, and then you start using by yourself, and then make sure that other staff also use it. So in conclusion, IT is a definite requirement for all of us in different ways, not only for your case sheets, but for all other areas of your hospital, especially when you are running your own centers. Thank you so much.